a moment about something other than the tax provisions. I have to say, with my friend from Missouri, and I do mean my friend from Missouri on the floor, we may not agree on the tax provisions, but we do agree on what I'm going to be talking about today, which is community health centers and children's health insurance. And I'm hopeful that as the senator was speaking about new markets tax credits, which I support strongly, and historic preservation, that they don't get hurt in this process at all. And I know there's work to do on this to make sure that doesn't happen. So, but I appreciate working very closely with my colleague and from Missouri on what I want to talk about today. I rise today to draw attention to the way the Senate majority is failing children and families in Michigan and all across the country. It's now been 60 days, Mr. President, nearly 2 months, 60 days since Republicans let funding expire for the Children's Health Insurance Program and community health centers. 60 days. And it doesn't have to be this way because we have bipartisan support to be able to continue the funding for both of these programs. Now, we also can't say we haven't had time. During these 60 days, the Republican leadership has found time for us to work on plenty of other issues. They've passed their budget. They've taken 75 floor votes. Republicans introduced their tax plan, which is now before us, and we're spending time this week on that. And by the way, they rewrote their tax plan in a way that would cause 13 million people to lose their health insurance. And the Senate has considered 24 nominees. But Republicans haven't taken any action to ensure that the 9 million children who have health insurance from the Children's Health Insurance Program can continue to get medical care, even though we have bipartisan support. In the middle of all the division going on the floor right now, we could bring something to the floor that would have bipartisan support and do the right thing for families and for children, and make sure that we're taking away the anxiety that families are feeling now across the country about what's going to happen. So 9 million children right now at risk because of inaction. CHIP provides children from low and moderate income working families with affordable health care. These are families that are working, they don't qualify for other kinds of help. These are working families, sometimes one job, sometimes 2 jobs, part-time jobs, trying to hold it together. They want to be able to take their child to the doctor. They want the peace of mind that comes from knowing that if their child gets hurt or they get sick, they can take them to a doctor. And in addition, the Senate majority hasn't taken any action on another very important community health care program to ensure that 25 million people who count on community health centers will continue to have a place to go when they get hurt, when they get sick, to take their child, to take their parent. And included among those 25 million patients are 300,000 of our veterans, 300,000 veterans. 7.5 million children that rely on health centers in our communities. You know, I've often said healthcare is personal, not political. There's nothing more personal than waking up in the middle of the night because your child is crying and they're sick. Nothing more personal than worrying about whether or not you're going to be able to get them the care that they need. Nothing more personal than wanting to know that you have a healthcare provider in your community who can help you or a family member manage your chronic conditions, high blood pressure, diabetes, other things, so that you don't find yourself getting sicker and sicker and sicker. Healthcare is personal, not political. And each one of these 9 million children and 25 million Americans are being personally let down by this inaction. And as I indicated before, it doesn't have to be this way. We could take action today. We have bipartisan support right now, bipartisan co-sponsorship right now. We could stop the divisive debate and take a moment to do something really important for families and children before the holiday season. Right now, we could ensure that families and children know that the Children's Health Insurance Program will continue in the new year and that they're going to be able to go to their community health center and get the care that they need for themselves and their family. I was really proud of the fact that Senator Hatch, our distinguished chairman of Finance Committee, and Senator Wyden, our distinguished ranking member, and all of us on the committee came together to put together a bipartisan children's health insurance program extension for 5 years. Came out of committee with only one senator voting no. I was hoping that that was going to get done right away. Why wouldn't it? It's something that could sail through here. And in addition to that, 70 members of this body, led by Senator Blunt and myself, we signed a letter of support for continuing funding for community health centers, and now Senator Blunt and I have put in legislation, bipartisan legislation, with 8 other Democrats and 8 other Republicans to extend funding for 5 years. I know if this came up on the floor, we could get this done today and ease the worries of families that are beginning to get notices across the country that their health insurance for themselves and their children is going to run out. These programs have long had strong bipartisan support. Why can't we get the action on this that these families and children deserve? But instead, families continue to wait every day, 60 days. I truly thought back in September that this is something that would be enough of a priority that it could get done amidst all the other things that have been brought to the floor of the Senate. But now the clock ticks every day, every day. This is wrong. We need to put these children and these families first. We might be 60 days late, but there's no reason we can't act today or tomorrow, before the end of the week, to make these children and families a top priority. Before CHIP, too many hardworking families in Michigan couldn't afford to take their children to the doctor. Today, 100,000 children are covered by My Child, which we call our Children's Health Insurance Program. 100,000 children. And with all the efforts to provide affordable health care that are going on in Michigan right now, successful efforts, 97% of the children in Michigan today can now see a doctor. 97%. They're at the moment not having to go to an emergency room and wait hours and hours and hours, or have their parents try to figure out what they can do to help them when they get sick. 97% of our children can now see a doctor, the highest level ever. And we should be proud of that. That's a good thing. Yet unless Congress acts soon, My Child will begin running out of funding as early as January, which is not very far away. Happy New Year. Lose your health insurance. January will also be a bad month for Michigan's community health centers. Nearly 20,000 people will lose access to health care. 20,000 people in Michigan who now are able to go to a community health center would see that access to health care go away, with thousands more dropped each month. Last year, Michigan's community health centers treated more than 680,000 patients. 680,000 people, including 12,710 of our veterans. They diagnosed coronary artery disease in more than 21,000 people. Nearly 34,000 Michigan residents were diagnosed with asthma and began to get help. Nearly 140,000 people were diagnosed with diabetes and could get help. All of those health conditions can be managed. We know that. If you have access to a doctor, to nurses, to medications, you can manage those kinds of chronic diseases. However, they can be deadly if they are undiagnosed and untreated. Just ask William. He didn't have a regular doctor after moving to Jackson, Michigan from Chicago, but one morning he knew he needed one. He woke up feeling lightheaded, so he went to the Center for Family Health, a great facility. They discovered that William's blood pressure was high, so high, in fact, that he was in danger of having a heart attack or a stroke. It took about a year for William's doctors to find the right combination of medications to control his blood pressure, but they were able to do that. He's been getting his care at the Center for Family Health ever since. They literally saved his life. Emily from Rochester Hills has her own story about the Children's Health Insurance Program. Emily's dad was laid off from 2 separate jobs within 3 years, at a time when her mom was working a part-time job that didn't provide insurance. That's a very common story for a lot of hard-working folks in Michigan, as well as across the country. Thankfully, Emily and her brothers and sisters had health insurance through My Child. It covered their sclerosis and asthma, a seizure disorder, and typical children's health insurance issues like bronchitis and broken bones. Emily's words are, "The Children's Health Insurance Program was a lifesaver for my siblings and me. I can't imagine the stress that my parents dealt with during that time and how we would have survived so well without the program." Emily and William know that CHIP and community health centers make life-saving differences for people in Michigan as well as across the country. We're 60 days late, but there's no time like the present to get this done. 60 days late. But we don't have to make it 61. Our children and our families should be put at the top of the list for action, not at the bottom. It's time to make things right for the 9 million children who rely on the Children's Health Insurance Program and the 25 million people who use community health centers. We shouldn't let one more day go by without acting. We can do this now. There is bipartisan support to get this done, and our children and our families deserve to have this done as quickly as possible. Thank you, Mr. President.